Central Party Committee and the State Council, localities across the country have kept a vigilant eye on the prevention and control while we promoted the resumption of business and the reopening of schools and the restoration of the normal social orders. Today we will focus on the normalized prevention and control efforts and the promotion of vocational health. We have with us Ombudswoman Madam Wang Bing from the Disease Control Bureau of National Health Commission, Deputy Director General Madam Xie Yang from the Vocational Health Department of National Health Commission, Director Fan Jingguang from Vocational Health Center, and researcher Feng Luzhao from CDC to take questions of concern. First, some updates on the pandemic. In the 24 hours of May the 16th, according to reports from provinces, cities, and Xinjiang Production Construction Corp, new confirmed cases numbered 5, including 2 imported cases. One was detected in Tianjin, the other was detected in Guangdong. There were 3 domestic cases detected in Jilin. There was no new death. New probable cases numbered 2. Both were imported cases. One was detected in Inner Mongolia. The other was detected in Shanghai. On the day, newly cured and discharged from hospitals, the case number was 8. 632 close contacts were removed from medical observation. Severe case was reduced by 1. On the front of imported cases, remaining confirmed imported cases numbered 44, including 3 severe cases. Remaining probable cases numbered 4. Cumulatively confirmed cases numbered 1,700. Cumulatively cured and discharged from hospitals, the total case number was 1,656. There was no death. Among imported cases, as of 24 o'clock, May the 16th, according to reports from provinces, cities, and Xinjiang Production Construction Corp, remaining confirmed cases 86, including 10 severe cases. Cumulatively cured and discharged from hospitals, 78,227. Cumulative deaths, 4,634. Cumulatively reported confirmed cases, 82,947. Remaining probable cases, 4. Cumulatively traced close contacts, 739,545. Close contacts that were remained under medical observation, 4,724. There were 12 new asymptomatic infections, including 1 imported infection. On the day, none of them were transferred to the group of confirmed cases. On the day, 58 were removed from medical observation, including 1 imported asymptomatic infection, and those remained under medical observation numbered 515, including 30 imported asymptomatic infections. From Hong Kong, Macau, and Taiwan, cumulatively received reported confirmed cases numbered 1,537, including 1,052 cases in the Hong Kong SAR, 45 cases in the Macau SAR, and 440 cases in the Taiwan region. On May the 16th, asymptomatic infections under medical observation across the country saw a 15th consecutive day decrease. All the remaining cases in Heilongjiang province were cured and discharged from hospitals in the past 3 days. New domestic confirmed cases numbered 9. All were from the close contacts that have been quarantined. We must adopt more precise and effective measures, accelerate screening, quarantine, recruitment and treatment to ensure resounding measures for the prevention of a resurgence. Now we'd like to take questions from the floor. Please ask questions on today's topic. Please identify yourself before you ask questions. Now the floor is open. The first question goes to the journalist on the first row on the left side. Thank you. With Shenzhen News. My question is that the overall national prevention and control has been good. However, the situation in the global community is still grim and complicated, so we are still faced with mounting pressure. What should we learn from the cases identified in Jilin province? How can we ensure we have pragmatic measures in place? I'd like to ask Madam Wang Bin to take the question. I'd like to thank the journalist for his question. As you have rightly pointed out, because of the pandemic is still raging across the world, we are faced with the pressures of imported cases, sporadic cases, and cluster cases. And this has brought new pressures and risks. The local cases detected in Shulan of Jilin province has reminded us about the loopholes. In some localities, there has been relented efforts. Second, in the transferring of inbound travelers, there should be more alert and capacity for the prevention. Third, such cluster cases have reminded us that we need to further expand NAT tests, in particular in the susceptible groups. Those that should be tested must be tested. In the context of normalized prevention and control, in previous days, the State Council Interagency Task Force has issued the guidelines on normalized prevention and control measures, in which 20 prevention and control provisions have been put forward. All these measures are very targeted and specific. In context of the cluster cases detected in some localities, we've provided policy circulars asking the localities to improve the safeguarding measures in the following aspects. First, interagency coordination must be improved. Health commissions must collaborate with civil aviation, railway, customs, and foreign affairs departments to further ensure the seamless provision of safety measures from the gate of the country to the gate of households. More importantly, we need repeatedly emphasize the 14 days of mass quarantine for inbound travelers. At the quarantine venues, the key links must be ensured by enhancing the training of staff, improving their awareness, and implementing precise measures. Besides, we must focus on the key links. For example, the 4 earlies, the monitoring over fever clinics, and online direct reporting. Once cases are detected, we must rapidly carry out epidemiological survey to identify the sources and closely trace the close contacts. We all know that it may be very difficult work which involves enormous efforts. On top of that, the prevention and control zoning should be as specific as possible to effectively cut off transmission so as to ensure early detection, precise management, and effective treatment. We need to expand the testing scope and coverage. In particular, we should focus on the susceptible groups, which has been divided into 8 categories in the normalization of prevention and control guidelines. So for all those that belong to susceptible groups must be checked, tested.
Thirdly, we emphasize the accountability mechanism, in particular the local governments, and also the enterprises, the individuals, and the communities. So these four-party accountability mechanism is extremely necessary, and also for the prevention and the control for the key target population groups are also emphasized. For the general public, health education should be strengthened, and the health tips should be promoted so that the whole society can cultivate an enabling environment against COVID-19. Only by these measures can we normalize the prevention, the control measures against COVID-19. Okay, let's continue. On the right, on the third row, the journalist in green in the middle. Thank you, with CCTV. It is reported that the Joint Prevention Control Mechanism of the State Council has conducted a dedicated evaluation. So how about the details? We will have Madam Xie Yang to take the question. Thank you very much for your question and also your interest in the evaluation. Indeed, in order to facilitate work resumption and prevent the potential resurgence, recently we conducted a special survey, and the focus of the survey is to evaluate the implementation of the prevention and control measures, in particular in the locations and workplaces with concentrated or large numbers of migrant workers and also people traveling from other parts of the country. The result finds that most of the businesses and business units can implement the measures in a sound manner and can satisfy the requirements for work resumption. And we have not found any incidences of resurgence of COVID-19. In the check, we also find that localities have adopted flexible and pragmatic measures. For example, they set up the house quarantine inspectors. With these mechanisms, the grid management is conducted and the healthy lifestyle is promoted among the employees. With these effective measures, we will make a summary of them and promote these conducive experience. Also, we will effectively implement the relevant measures to create a sound environment for work and living. Okay, let's continue. On the right, on the front row, the lady reporter in the middle, please. Thank you. With Hong Kong Economic Herald. In the construction sector, there are a large number of workers, and the working conditions are quite complicated. What are the specific requirements? It is also said that the year 2020 will be the hottest year in the summer. So what are the tips to share with the construction sector? We will have Mr. Fan to take the question. Yes, for the construction sector, it involves many subsectors like civil engineering and house building. So the number of workers in the sector is only second to the number of workers in the manufacturing sector. According to the national data, by the end of the year 2018, there were 58 million workers in the construction sector. The health of their workers in the sector is of great importance to the overall society. There are also many risk factors in the sector. In the fight against the COVID-19, the following measures should be emphasized. First, to emphasize the management in the field or on the site. In principle, there should be closed-loop management, and without invitation, no one should be allowed to enter the construction sites. And also, health management should be emphasized, especially in the working places, like the channels and the tunnels. And secondly, we need to strengthen the management concerning the dormitories. For construction companies, the workers usually stay in the dormitories. So for the dormitories, there must be open windows, and ventilation should be paid attention to. Also, there should be specific measures to have disinfection appropriately. And thirdly, efforts should be made to minimize the potential gathering or crowding. Also, the flow of the personnel should be controlled, and also the breaking time should be extended. And also, for dining, we advocate the peak shifting dining practices. Also, it is necessary to provide sound personal protection facilities. The occupational health should be ensured by providing the relevant supplies and materials. Also, there should be health education concerning occupational health to ensure hygiene practices, healthy lifestyles, and safe occupational practices. The second question you asked about is about the high temperature in the summer. For construction workers or other workers working in the open during the summer, this is extremely important. Summer is coming, and the outdoor temperature is rising. The employers of the construction sector should take the following measures to protect the health of their workers and the fight against the COVID-19. First, they should have constant check for people with inappropriate health conditions. They should be reallocated to posts which are appropriate for them. And also, there should be sound medications or drinks to help create an enabling and healthy environment. And also, in the hot hours, the work shift should be more frequent, and also the occupational health knowledge should be promoted so that the workers can protect themselves against the occupational hazards or problems. There should also be drills conducted to train the workers. In case of any occupational hazard, the workers should know how to protect themselves. Okay, let's continue. On the left, on the fourth row, the lady in the middle, with Phoenix TV, we find that in the service sector, especially in the household chores and the catering sector, how can the employees protect themselves? And also in low-risk areas, is it necessary to put on the face masks?
Researcher Feng Luzhou is taking the question. In a relatively long foreseeable future, we will still be faced with the sporadic cases, imported cases, and the cluster case risks in China. You've been asking about the homemaking, supermarket, hospitality, catering, transportation, and service sectors. Also, the reception people who are working at the counters, they are faced with a bigger people movement, and they have to face the customers. So they have naturally a higher risk of infection. Therefore, they need to protect themselves by wearing masks with a better hand hygiene. When conditions allow, they should try to maintain a safe physical distancing at the workplaces. Good ventilation and sanitation should be in place. Health monitoring should also be conducted on a daily basis. If they show symptoms of dry coughs, fatigue, or fever, they need to get medical advice as soon as possible. The second part of your question is on the wearing of masks. This is a question of a common concern as to whether it's necessary to wear masks. We should follow the following criteria in a well-ventilated environment, and the physical distancing can be kept. Masks are not necessary. In specific, if it is an outdoor environment, like in a park or spacious streets or on the school campus, venues, stadiums, outdoor stadiums, or if you are doing sports, we do not recommend the use of masks. And also, if you are in a low-risk region without the reports of confirmed cases in recent days, and if in the meeting rooms, schools, offices, well-ventilated environment can be ensured and physical distancing can be ensured in conditions as such, we do not recommend the use of masks. But in three conditions: first, in a confined or semi-confined spaces. For example, if you are in public transportation vehicles or in a lift or in a crowded public place, we suggest that you wear mask, because there might be the approaching or a proximity with the asymptomatic infections. Second, if you have already developed respiratory symptoms, for example, fever, or you develop coughs, then you should wear masks to prevent the passing on of a pathogen to others. It is not only for the COVID-19 response. Actually, it should be an adequate for each of us. If we are sick, we'd better wear masks for the protection of others. Third, if you go to hospitals, either to seek medical advice for yourself or if you are accompanying a family member or a friend, in hospitals, we suggest the wearing of masks so as to reduce the risk of infection. Thank you. Next question goes to the journalist on the second row on the right side. Thank you. With CCTV, many manufacturers has assembly lines and crowded staff. So what are specific requirements for the manufacturers? I'd like to ask Director Fan Jingguang to take the question. Thank you for your question. Manufacturing industry involves a lot of sectors. For example, food assembly, the machinery assembly, food processing, and the textile manufacturing. It involves the biggest number of workforce according to the State Statistics Bureau at the end of 2018. The total employment of the manufacturing numbered over 100 million and 4,700,000. The garment, textile, shoemaking, and other assembly line manufacturers have crowded rather crowded staff, but in electronics and drug pharmaceutical manufacturing, they have to work in confined spaces. For enterprises like this, they should focus on the following prevention control measures. First, a regular disinfection should be in place to ensure the sanitation of the workplace. Disinfection should cover the surface of the most frequently touched items like buttons, knobs, and other frequently touched items and surfaces. In the meeting rooms, the canteens, or the recreational spaces, or other public areas, and items in these areas should also be put on regular, periodic disinfection with dedicated people in charge. Second, good ventilation should be in place. If the process allows, we should prioritize the choice of natural ventilation. If the conditions do not allow, we can support with the mechanical ventilation. In the workshop of the mechanical ventilation, the inlet of the fresh air should be put and established in a clean zone with the inlet volume up to standard. In manufacturers where they use the central air conditioner, good cleaning and the filter cleansing, and the wires should be cleaned on a regular basis. Besides, personal protection should also be in place for those who contact the dusts or the chemical hazards. Manufacturers should follow the vocational health management provisions and provide the workers with standard masks, goggles, face shields, protective gears, protective gloves, and other personal protective equipment. At the same time, manufacturers should guide the workers to properly equip themselves with the protective devices and items. Gloves should also be one of the protective items used by such workers. Next question goes to the journalist on the third row on the left side. Thank you. With the China Education TV, we know universities, secondary and primary schools are gradually reopened. Parents are very much concerned about the prevention and control efforts on campus. My question is, what are the particularities of school prevention and control? I'd like to ask Madam Wang Bin to take the question. Thank you. As we are normalizing prevention and control measures, we see the gradual restoration of economic and social life. The schools are reopened. The wide-scale school reopening has, to some extent, increased the difficulties for prevention and control. It might be a stress test for our prevention and control efforts to ensure good work in the school reopening. National Health Commission, along with the Ministry of Education, has worked out prevention and control technical guidelines for the campus. You may have already seen such technical guidance. The purpose is to guide the overall school reopening. The two ministries convened video conferencing to ensure the implementation of the technical guidelines. We should focus on the following aspects. First, we should establish a coordinative mechanism with improved and comprehensive prevention control mechanism. Health institutions should work along with the schools to ensure point-to-point coordination mechanism. Guidance should be provided to schools to have their individual prevention and control plans, emergency preparedness plans, and other mechanisms so as to implement all the prevention control measures. Second, schools should provide health monitoring over faculty and students. In particular, for classes, we must have 5 checks in the morning, in the afternoon, the absence record, the symptom checks, health and temperature monitoring among students, symptom checks. In particular, the absent students must be understood thoroughly to forbid the sick children coming to schools.
In resuming the schooling, we need to control the density in the campus and in the classroom. There should be safe distance kept among the students, and also it is necessary to strengthen the environmental health, especially in the classrooms, the dining halls, the dormitories, and the restrooms. Clean and disinfection should be conducted. Also in the classroom and the offices, there should always be open window ventilation. Hygiene practices should be taught and implemented, especially the hand hygiene practices. The kids should always have their hands clean to prevent the potential risk of infection. And also, in case of suspicious symptoms, schools should be immediately reported, and the health authorities should also be informed, and there should be home quarantine or hospital visits for any potential suspicious cases. The school should launch the response mechanism. The local governments or government authorities should strengthen the inspection and help the schools to improve the response so that we can minimize the risks of school reopening and ensure the safety of the children. Okay, let's continue. On the left, the front row, the reporter in black, please. Thank you. With CCTV News, new media. Now the COVID-19 response becomes a normalcy and work resumption is being accelerated. What are the measures the companies should adopt in this context? We will have Madam Xie Yang to take the question. Thank you for your question. As the response measures become the normalcy and companies are resuming their work and operation. However, I want to repeat the sentence which I hope will not bore you. That is, we have to ensure the safe environment before we restart the economy or the work operation. We need to come up with targeted, science-driven, and accurate measures against the COVID-19. For companies in low-risk areas, they should be timely informed of the flow of the employees and the risks they are exposed to. For people from high-risk areas and inbound travelers, health management should be conducted following the specific requirements. Second, there should be response mechanism and preparedness plan developed. In case of any suspicious or confirmed case, the response mechanism should be initiated and implemented. Also, we should have early reporting, early detection, early quarantine, and early treatment. Thirdly, we need to ensure the ventilation in the working places. Also, for living and working places, there should be sound disinfection measures, and potential gathering or crowding should be avoided. Also, disinfection should be conducted in the dining halls or the meeting rooms. And fourthly, we need to cultivate the healthy lifestyle the anti-epidemic practices should be advocated and promoted. Also, for high-risk areas, apart from the measures they've already taken, they should also try to create an enabling environment for the companies to restart the operation and production so that to avoid the potential resurgence. Okay, one last question. On the right, on the second row, the lady reporter in the middle, please. With JKB, as the epidemic situation stabilizes, many companies need to dispatch their employees for business trips. So how to ensure the safety in the business trips? We will have research fellow Feng Luzhao to take the question. Thank you for your question. For people who have to have the business trips, they should get sound personal protection. They should try to get information about the target destination, like the local policies and also the local epidemic situation, and get prepared. For instance, they may need to bring with them the masks and the hand sanitizers. And also during the traveling, if they have to take public transportation vehicles like the airplanes or the trains, they need to follow the requirements and queue in the line to keep a safe social distance. And also they should wear masks throughout the journey and minimize the time to take off the mask and to eat the meals. Also, when they go to the destination, they should try to stay in hotels with appropriate disinfection. And of course, for the hotels, appropriate disinfection should be conducted and ensured. Also, for dining, I'd like to emphasize about dining because previously we found some clusters caused by the group dining. So we suggest to avoid the group dining. If it has to be a group dining, the outdoor group dining is preferred. For indoor group dining, we advocate the healthy practices like the public chopsticks or forks and knives. And also during the business trip, in case of any suspicious symptoms like a fever and a cough, the person is strongly suggested to seek the doctor's advice. Okay, thank you so much to our speakers. During today's press conference, we have speakers taking questions concerning the normalization of the response measures and the occupational health. At the moment, the focus of epidemic control is to prevent overseas importation and internal resurgence. So in the entry points and the borders, there are increasing pressures against COVID-19. This would be the topic for tomorrow, and we will have experts from Shanghai and Guangxi Zhuang Autonomous Nationality Autonomous Region to take the questions related with the topic. We look forward to your continued attention and attendance. That's all for today. Thank you.